Thank you all for taking the time. I see some familiar names in here, so excited that you took the time to come join us. So I have my presentation to go over here today. So today we're going to go over addressing nursing workplace violence, and this is specifically for simulation educators. So we're going to go over some techniques and implementation plans that we can take to improve de-escalation training. So we'll get started here pretty shortly, but here in the Q&A box, I would love to kind of just get anybody's feedback here. I'm going to post a question and you guys feel free to put your answers in there if you want to participate. But how do you train your students on de-escalation today? Whether you're a hospital educator, a nursing student educator at a higher education facility. I'm just curious on how you guys currently do it and how you integrate. Today we're going to go over some strategies, but obviously learning from others is always the best way to go as well. So we'll be would love to just learn and see how you guys currently do it today in your simulation labs and what have you. So it is discussed in the site course currently. Yeah. So we'll go over some innovative ways and how we can address it in pretty much any course. So I'm excited to show you guys that. So just before I start, just want to clarify, can everybody see my presentation? You can just put in the chat there and I'll be keeping an eye on it. Perfect, thank you. And if anybody does want to come on here and speak, I can unmute you and we can have a conversation. So if you do want to put some, some expertise on something I'm talking about, I would love it actually. So if I can, if anyone feels like doing that, please just let me know in the chat and I'll unmute you and we can talk. And you can kind of, take over and give your feedback on something or something that worked well for your students. So that's really the whole point of this webinar, is to learn from each other, really. But we'll be going over some of our own ways of doing de-escalation simulation with our technology. So I'm going to go ahead and get started here. What we'll talk about specifically are these four things. We're going to talk about the issue that's been going on for a long time, but as you guys have probably seen, there's been extra coverage on nursing workplace violence. So we'll talk about the key statistics on that, the reasons why. We'll talk about the core principles of de-escalation training. So that includes theoretical learning, the role it plays, simulation learning, and of course, core techniques that we can teach our students to continue practicing. Then implementation. So what can we do as educators to implement this into our programs? So we're going to learn how to organize and integrate it into curriculum. So a lot of, from what my personal experience as a nursing student and as a nurse myself, going through the ICU is where most of my experience was. Psychiatric or de-escalation or anything like that, that training is usually held in the psych course. So we were going to talk about some ways you can do that even outside of that, because honestly, as we all know, just because you're not a psych nurse or you're not in a psychiatric setting, you need to know how to de-escalate, because you can be in a med surg and you get experience on it. So there's ways that we talk about today and how we can best integrate it into our program. And then lastly, innovation. So what are some new technologies out there? Of course, we'll be talking about ours at the end and how we provide on-demand de-escalation practice. And we'll talk about the educator's role in that as well, and helping improve the de-escalation training and hopefully lower the nursing workplace violence. So. All right, so recent stories that have been presented or put on the news recently. So one that you guys may have heard about is the UPMC Memorial Hospital. This is not a new issue. It just has been increasingly become more popular to make the news, of course. But at the UPMC Memorial Hospital, 3 workers and a couple officers were held hostage in the ICU from, it looked like from the last time it was updated, a family member that came in and was upset about the care that their family member received, it seemed. They came in with a gun. And of course, that there was a shootout in the ICU, and then one of the police officers was killed. But that, of course, involved a healthcare situation. And yes, the slides will be available if you want a copy of them. Yep, good question. And then recently also in HCA Florida Hospital, a nurse was beaten so badly that almost every facial bone was fractured and may cause permanent damage. And then this is not just a US issue, this is worldwide. So overseas, this also happens, and a nurse was recently stabbed by a patient that was upset due to long wait times. So I can speak. I think almost every nurse probably has a situation, if not verbal abuse, physical abuse could have happened to them. Just because, we all know that healthcare settings are not the perfect place. It's usually if you're meeting somebody there, it's one of the worst times of their life, whether it's the patient or family member, even coworkers. It's a high stress situation. So there's a pretty high risk of even coworkers that are, causing workplace violence with each other. So, but one thing that actually, when I was doing some research on this topic, was interesting is that out of all the workplace violence, so all the work sites, every industry, 75% of those cases are in healthcare. So it is just naturally getting into our industry. It's a higher risk than others. So 75% of nearly 25,000 workplace assaults reported annually occurred in a healthcare or in social service setting. That, like we just talked about, could be a range of things, as including patient agitation, confusion, all those things that we understand if you've done any patient care that could easily something could happen physically. Also, too, mental health crises. So that could be family members, the patient themselves. Like I said, not a good time. Usually, if you're in the hospital, it's not a great time for them. So that's just your nature, your workplace. But it is not a great situation for that person. So you're bound to get in contact with somebody who's upset, and that's why we talk about our de-escalation training. In our opinion, as a company, a nursing education company, shouldn't only be held as just psych courses. It should be integrated throughout the entire curriculum, because med surg, ICU, psych, doesn't matter what field you're in, what specialty you're in as a nurse, you're going to need to know how to do de-escalation training. So patient agitation, mental health crisis, long wait times, and substance abuse. And the rise of workplace violence, not so sure if it's a recent rise in it. It's been an issue for a long time, but there has definitely been some more attention placed onto it. So the ANA recently came out with a stat that showed that 1 in 4 nurses have experienced workplace violence, which is supposedly a rate higher than that of police and correctional officers. And then they're also 5 times more likely in general to suffer from workplace violence. So it is definitely an issue that should be addressed from the very beginning of being a nursing student, not to, of course, scare your nursing students away, because obviously it is, when you look at the news of those kinds of things that we just looked at, the hospital situation where the ICU was held hostage, all those things, of course, are going to just naturally possibly scare someone away from the profession. So there are, of course, policy things that us nurses could, address, and like the entire healthcare industry needs to address. But where we can actually make an impact as educators is just improving our integration into our curriculum and de-escalation training. So we can't control everything, unfortunately. We don't have a whole lot of power over, the healthcare settings and every single hospital setting that your student goes to after they graduate. But there is a profound impact that you can make while they're in school with you, and they'll be less likely to experience something like this after they leave your nursing school. So that's really our goal today, is to kind of come up with some strategies together. So like I said, if you do have something to, some comments to put on a slide here, I'll unmute you, and you can, of course, give us your input on it. But we all know that this has been an issue. It's just becoming more and more of an issue if we do not address it. So why simulation? So we are a simulation company. Theoretical learning is great for grasping strategy. But as we all know, the real world, it's very unpredictable. It's very variable. Not everything's the same every time, so not everything's so standardized. So the theoretical learning is great for getting those strategies down, understanding what are the different techniques you can use when you're de-escalating somebody. But the role play, the simulations, are a huge piece of just getting that practice in, that unpredictability in, because not every situation is going to be the same every single time. So giving them that repetition to practice those theoretical strategies is something that needs to be combined. And like I said, not just in your psych courses, but also throughout the entire curriculum. So we want a comprehensive competency in this. And also too, just like I have an athletic background, So athletes learn from repetition. Everybody learns from repetition, but one thing that athletes in sports generally do is do so much repetition till they don't even have to think about it, basically. That's really how nurses should be training for this. And we all understand that there are barriers to get de-escalation training, which is something our company is specifically focused on, is surpassing that barrier. So you don't want to just rely on the theoretical learning and just reading it in the textbook. If you don't get enough actual role play and then simulation practice with it, you're not going to be good at it. You know, you can understand so much to the point where something catches you off guard in de-escalation in the middle of the conversation, and then it's over with basically from there. So, and also too, you can be good at it for a little bit, but if you quit doing it, you're not going to be so good at it after a while. So this is also something, if you're a hospital educator, how can we integrate this into their continuing education consistently and not just give them the theoretical learning, but also give them the role play and the consistent practice at it without, of course, risking them in a real situation. So that's something we're going to talk about at the end with the innovation slides. So we're not going to spend so much time on like the actual education piece of it, more of just like how can an educator implement and plan this out. But as we know in a lot of writings and theoretical learning, we talk about those core principles of de-escalation training. These are just some of the de-escalation training techniques and the principles that we should all follow. So having situational awareness, so recognizing early warning signs, emotional regulation, so staying calm and composed under stress. That's something that you cannot teach with just reading in a book. But once again, that role play, that's where simulation really comes in. Using non-threatening body language, once again, role play, and then active listening. So we can read this on the slide and understand that these are the techniques we should be using, but with simulation, it really helps you put it to practice. You need to practice it. You need to do it over and over again, which today is just really not possible with just even traditional simulation practices, which, you do your mannequin-based training or you do standardized patients. You can only do it so many times without, running out of time basically with your students. So that is something we're going to talk about today. So some of those key strategies that their students is more likely to be a victim of workplace violence just because they're learning the role still and they're not as confident in their own skin to set boundaries with themselves. They don't necessarily understand. So that's something as us nursing educators can do by giving them repetitive practice and help them understand, okay, if something like this happens, what are the boundaries I should be setting and what are the next steps and how do I know when is it failed? I think that's also a big one, is just knowing like when is it time to exit, basically. You've tried, and then when is it time to exit? Because if you know that, you at least prevent the entire, you prevent the worst from happening. So that's just something that, we can all, and I know you all are pretty much experts on this, so we don't need to teach you on the strategies and the techniques and everything, but more of just what we could focus on when we do this at scale is what we're going to talk about today too. Any questions so far, guys? I'll stop there. I know it's a lot of big introduction of what we're talking about today, but anything that you guys wanted to input on what we just talked about, these last few slides, feel free to put in the chat there. But otherwise, I'll go ahead and move on. So organizing a de-escalation simulation training. So as we know, we would like to do some pre-briefing. We'll do the simulation. We'll look over the performance, do the debriefing, and the reflection afterwards. So what we thought was pretty impactful for some of the students doing our simulations is that they review the theoretical learning strategies that they learn in lecture or maybe in the sim lab. They review that while they're pre-briefing the case that they're about to experience. So that way they can really remind themselves, okay, these are the strategies I specifically want to practice this simulation. Maybe just we go in a tactical route. Like, okay, we're not just going to try to do the whole thing all at once right away. We're going to just really focus on specific techniques for this specific simulation. If they do that well, Then maybe you could do another simulation that's focusing on, it's maybe the same sim, but you're focusing on different techniques this time. So we go back to those past slides here. So for example, we could have one simulation that's only focused on these two. And then the next two, or the next one, we could be focused on using these techniques. So it's going in a more tactical route. That's what we've kind of found being successful from our own simulations here. And then when they get in the simulation, of course, they do the role play, they do the simulation. We'll get into how our simulations specifically work and how they can do it at scale and repeat it at any time they want. And then the performance. So immediately after the sim, they get to see their performance and see, okay, what was the likely outcome if it would have continued on, or maybe there was an outcome and okay, let's review and why that happened, and then debrief and actually combine that theoretical learning that you already, we went over in the pre-briefing, and then tie it into your experience and see and be able to, provide that clinical picture, help them understand what was the reason for this or that and why they chose to do something. So, and then lastly, reflection, just getting a general idea of that points towards their preparedness. So these are some of the debriefing questions that we've used in our simulations after they do a de-escalation scenario. So going over techniques and effectiveness, we could ask questions such as, so do you know what de-escalation techniques did you use? What techniques were the most effective in calming the patient? And then going over to the patient perspective, going in and helping them understand that. So how do you think the patient perceived your actions and responses? Did you acknowledge the patient's concerns effectively? And then if you were the patient, I thought that was a good question. What would you have wanted from the nurse in this scenario? So sometimes, of course, you can't answer all of them, but because depending on the scenario you're in, but it is nice to kind of get both your perspective and trying to get the patient's perspective based off your actions. And then reflection. How did you feel about the interaction? What emotions did you experience? Because this is just as important as understanding the debriefing aspect of, the patient perspective and techniques. And then going on to what's the action items. Let's create some action items for you. If you could redo the scenario, what would you do differently? Okay, well, let's redo it and let's do it differently. And then let's review it again. So doing this at scale and practicing it continuously throughout the entire program, we believe that this would make a huge impact on the workplace violence rates because obviously we're not going to be able to de-escalate everybody. Not every situation is even related to what you can control, like the UPMC hospital situation that we talked about earlier. That's probably not something you can really control. Like maybe you could have maybe a nurse maybe had some hints on like, okay, where they're kind of talking aggressively before they even ever came back. But really, realistically, we're not going to be able to prevent everyone, but there are a lot of them that we could prevent. So that's just something that, as educators can focus on, at least trying to control the things we can improve on. So, so integrating it into your training, your curriculum. So this is just something that we believe in as a nursing education company, is using theoretical lectures and actually having role play in the lectures as soon as you learn those key strategies. So when you're going over it in class, I know a lot of programs do this in their psych courses. That would be, of course, where they probably learn the foundations of de-escalation training, all that. During that time, we feel like it would be very helpful to do this while in class, right after they learn the strategies and techniques, and doing role play even in lecture. So if you learn a strategy, then you could immediately have a student role play with a situation that you're doing, and you can bring in technology that we'll show you, and actually have them interact with an AI character that it displays these symptoms and aggressions. And then lastly, so of course this is the typical way of doing it, using traditional simulation, standardized patients. So doing active role play with a standardized patient, which is good. It's just the only difficulty is that it's not scalable at times because you eventually just run out of time to get everybody in or have repetitive practice anyways, or maybe it's just not one-on-one. So every program is different, of course, but if that's something you're struggling with, there is a third way to integrate, and it's immersive simulations with AI. So if you guys have went in this webinar, you probably had an idea that that's what we do. We're just sharing some of our feedback that we've received and our experience and providing it at scale. So this is just one way we believe is a good way to integrate de-escalation practice, of course. So it's on-demand dynamic training with aggressive AI characters. So you're not really relying on educator availability or space requirements or time requirements that you guys have. See, these are really the issues that we as a company try to solve. So not just the education quality and the realism, but also at the institutional level. What are the issues that even prevent nurses to get the training in the first place? And this is something that a lot of institutions struggle with. They have a limited educators, they have limited space, or they have limited ability to scale in general. So there's just limited time to do things. So how we solve it and how we believe that we can scale de-escalation training into programs is using AI facilitation and VR simulation. VR simulation just makes it more real and it's more immersive and it feels like the real thing when you're interacting with the characters and the patients. And of course, getting that performance tracking, because that's a whole nother thing that takes a lot of time. And it's really hard to evaluate de-escalation performance. Obviously, it can be obvious at times whether or not you de-escalated the character, but there are the evaluation on the specific techniques that you can take to prevent this from escalating. So there are some ways that you can do this at scale as well with our product here. Any questions before I get into how we do de-escalation training at scale? Any questions on or any input that you guys have and how you guys integrate? I would love to just kind of learn more about you guys and how you guys integrate it. But anything that you guys feel that I'm missing here in this presentation? I'll wait just a few seconds for you guys to start typing or anything like that. But these next slides, we're going to start talking about the innovation. So how do we do it at scale? So those barriers that we just showed you here. So what are the problems? So these are problems that directly impact your students' ability to even get de-escalation training throughout the curriculum because there's just not enough resources in general. So how can we use technology to give them those resources? So that's just something where we come in and we have the expertise to share today. So that's where we'll end the webinar today. But anything, I'm just curious on if anybody has any input on how they have integrated de-escalation training into a program, and if you guys have anything you'd like to share with other educators on here. It's always helpful. But if not, we'll go ahead and continue on. So you have an in-person simulation scenario. How often do you guys do it? And do you use a virtual simulation game? That's good. Have you all done anything kind of I guess, creative, like an escape room kind of thing, or like where they kind of not so much focus on the direct interaction, but maybe focus like a simulation that kind of helps them find the key strategies, for example? Anything like that you guys do? Feel free to share. So I'll go ahead and play this video here. This is just a short video, an example of AI characters and what they can do for de-escalation training. So you can communicate naturally with your voice with these characters. It can be used for other things outside de-escalation training, like soft skills and cultural sensitivity, professionalism, therapeutic communication. But the nice part is they're communicating with them just like they would with a standardized patient, a real human. But they also have the emotions and the personalities that you would want your student to see when they're doing the role play here. So this is just an example of me talking to a patient that doesn't want to take his medications. And that's kind of really just the conflict here is that we have medications due and they don't want to take it. Okay, I'm reading somebody's here. So we just finished a VR-based simulation training regime for pediatric psych patient de-escalation, 2 in the headsets, 5 in the audience, trained approximately 2,000 folks over the last 9 months. That's awesome. So did you find that VR in general was easier to, do this compared to other traditional methods? Like, did you find it, because obviously it sounds like you kind of casted it up on a screen so more people can watch, not just the players? Yep, I agree. So it makes it much easier to access, and I think it makes it feel more real for your students too, because sometimes there's those little little barriers too, just even with standardized patients, or like maybe it's the instructor that's pretending to be the patient. Sometimes they can't. A lot of students can't get past that barrier that they're talking to somebody they know and they know it's not real, But when you put them in a situation where they don't really know what to expect and they don't know what's underneath, like it's just a person from just like they would be at the hospital, it does make a big difference. So, is this designed just for school education or can it be integrated in a hospital education program? So, yes, it's integrated into both. So, this can be used for just anywhere where de escalation training is needed. So, we think nursing schools, um, we think hospitals where they are onboarding their new nurses or they're doing continuing education. Because one point I made earlier is a lot of nurses get de-escalation, uh, continuing education, but a lot of times it's just watching a video of someone else doing it, or it's just a PowerPoint, and that's about it. What's really missing is the actual role play, the consistent role play of doing de-escalation, because that's really you're not going to be good at it by just reading about it. There's just you're never going to know the unexpected. You're never going to get good at going at things on the fly because things are just so variable and unpredictable in these situations. So we don't have we don't sit at a desk and have a task list that's the same every single time. Like everybody has these unique personalities, these unique needs, and we need to understand how to, respond to that on the fly. So hospital librarian here, a nurse colleague and I created a poster on what we're doing and how medical librarians can assist. We made it for the library conferences, 3 so far, which is why it gives librarians so much exposure. You can download from here. The QR code doesn't work. Eventually, I'll upload the revised. So how many hospitals and schools using the system? Well, don't know the exact number, but we have a pretty good amount of both that use it for de-escalation training. But de-escalation's useful anywhere, honestly. Not what's even outside of work, healthcare. But this is obviously, as we talked about earlier, this is a pretty high frequency of needing de-escalation practice. No matter what specialty nurse you are, you're likely going to be in a situation where you're going to need it, which is why we believe something like this really gives people the opportunities to practice. So I have a comment from David here. I'm very excited to utilize this product for de-escalation. The violence against healthcare workers is a significant issue. I've trained jiu-jitsu for 15 years. That's pretty awesome. And have had to use those skills in multiple healthcare environments when de-escalation fails. I want to introduce a healthcare worker version of jiu-jitsu to students in the future. I could use this type of scenario to teach and demonstrate the value of de-escalation. In the debriefing section, I will ask the students if they feel that they would know how to keep themselves safe if the de-escalation fails. I like that because I feel like as long as you know how to exit and when to exit, I feel like obviously you might not everybody's going to be good at de-escalation. Obviously anybody can be good at something after repeating it over and over and over. But there's levels to it, of course. Everyone's just better. Some people are just better at communicating than others. But I feel like as long as you teach them the way to exit and how and when to exit is really important. I feel like that's where we make a real big impact. So a question like that in debriefing is really important. I'll continue reading. Those responses, hold on. Those responses will assist in getting further buy-in for the next project. My wife currently teaches bridge building in her mental health course, which has verbal and physical elements of de-escalation as one of the first clinical days. I like that a lot. We have filmed basic self-defense videos, but would love to expand beyond that. I would love VR's repeatability, immersive nature, and ability to gather data for their needs. Yeah, that's really cool. I like hearing that, especially on day one too. Like, because like if you think about it, fundamentals in nursing schools, really their focus is on at least first helping the nursing students understand their role. And I don't see why not actually that they should at least understand what are the standard boundaries between you and a patient relationship, which I know they talk about, but maybe more highlight on the de-escalation training in general. Just maybe making that a skill right away, something to be aware of. Because when I was in nursing school, and this is just me personally, it's different for everyone, but when I was in nursing school, I never really actually never even had the thought that is really something to deal with. I mean, obviously you get patients that are upset, they're just generally not happy. But as of like more like those escalated situations, I always thought that was I don't only see that in psychiatric hospitals. You expect it there. But it is, pretty common in just a normal hospital too. So That's something I didn't expect coming into the ICU. I had a lot of moments myself where things could have went the wrong way if they weren't taken care of and addressed immediately. So it's just as important as documentation for a nurse. That's not something you just have to learn and learn how to do, and it's a part of your daily life pretty much is learning how to de-escalate any situation. So, and a question: do any nursing schools have their students follow WPV response teams as part of their hospital rotations? That's a good question. I don't know if anybody can answer that. But that would be, I'm not sure if anyone's answered it yet. Not yet. So I'm not part of any nursing school. So that is a good question for people who are. So I'll go ahead and continue playing this video. Feel free to continue commenting in here. It's really fun to actually, get people's inputs and everything. It makes it much more comprehensive here. So we'll go ahead and play this video just to provide a short example. And we'll cut this out an hour. If we do have time, I'll actually get into a VR scenario together today, and you guys can see inside my screen. So we'll do that. I'm going to go ahead and play this video. Let me make sure it's sharing sound. Let me know if you can't hear it. Name's Will. I'm going to be your nurse today. How are you feeling?
Oh, great. Another idiot trying to poison me with meds. Listen, Will, can you please just get this over with? I don't have time for this.
Oh, I'm sorry. What do you not have time for?
This conversation, for one. And all these stupid meds you keep trying to shove down my throat. I know what you're trying to do.
So there's one little short conversation.
Shut up.
You stick your tongue out?
Shut up. My tongue is none of your business. I can do whatever I want with my own body. And another thing, what are you doing staring at me like that? Can't you see I'm busy talking to the voices in my head?
So just some very short clips. We'll give an actual scenario here in a second. We'll probably do it together here to kind of bring the picture together if you haven't used VR before. But that was just some very short clips of those AI characters. That wasn't anybody talking for them. That was an AI character that somebody, an educator, has customized themselves to give a certain personality or a certain culture to communicate with their students and challenge them in any way they want. So that's how that works. So when you do create your characters, you can adjust their mood, their personality, their knowledge. So that way, once again, you get the exact, kind of like creating a standardized patient, where you don't have to use a script anymore, though. You can just give them the knowledge they need to understand about something, or maybe it's delusions or hallucinations, and then you're good to go. And it's at scale. You can do this every student individually. You don't have to do it, as a group. Like every student should get to practice themselves. And then they can go into group debriefing or, watch another scenario together as a group debriefing and reflect on that as well. So there's a lot of great ways we can integrate this at scale. So as we mentioned earlier, there's de-escalation training is really not just only held to psych, even though obviously that's where it's most common, but it can be done in med-surg, critical care, psychiatric, OB, and pediatric settings. So giving them that comprehensive experience is really nice. We have lots of de-escalation scenarios that educators can just use that are pre-built by our nursing educators. So that's just something else is that if you guys do want to see that, make sure you contact our nursing team and we can share some more curriculum-based stuff that how we do it. So, all right, so I'll go ahead and let you guys ask some questions. Feel free to put anything in the chat there. So while you're doing that, I'm going to go ahead and start working on casting my screen up, and we're going to do a scenario together. So we'll just get into a general de-escalation scenario that I built today. So when you have let's say you do have VR integrated into your program, or you already have something, all you really actually have to do is, or all you really need is Wi-Fi and a VR headset. And you don't need anything else fancy, no computers or anything. So your students, if they even have their own, they can get in it and practice on demand. So like if you leave open like an open lab scenario for them to just practice de-escalating, and they get that nice feedback that you've set beforehand, then that is as simple as that. They get on demand de-escalation practice. So I'm going to go ahead and stop sharing. And we're going to go ahead and get into a scenario together. Here, so we'll go ahead and do the assignment together. So I'm a student in our course. We'll go ahead and start an assignment. So here's our pre-briefing. We'll go over the scenario together. We're going to be talking to Sanjay Reddy. He's a 60-year-old male with a history of schizophrenia, major depressive disorder, substance abuse, and generalized anxiety disorder. He presented to the emergency department with chief complaint of acute psychosis brought in by local police authorities. As a nurse, you'll interact with an acute psychosis patient and implement therapeutic communication. So learning objectives, we won't be given medications in this scenario, but the student will use accurate assessment techniques, develop a systematic approach to acknowledge and treat a schizophrenia patient, and explain pathophysiology of schizophrenia in emergencies. But in this scenario, I made this patient aggressive. So I can, of course, show you guys how that works after the scenario is over, but this patient will be aggressive when we get into the scenario. We're going to be into an inpatient hospital room. We're going to have access to vital signs monitor, all the things that you would need to give medications, and we can collect labs as well. So once again, past medical history significantly is schizophrenia, substance abuse, major depressive disorder, and generalized anxiety disorder. They have some lab results. We won't play this video just because it's about 3 minutes long, so I don't want to bore you with that. But that is the pre-briefing experience here. We hit continue, and now it's time to get into the scenario. And once I'm done, you guys will see that I have a grading report to look at as well. So give me about 2 minutes. I'm going to talk to the patient first before I start casting. And then once I do, I will begin casting right after that. So you guys will be able to see inside my headset. So I'm putting it on, and all we have to do is basically get into the application and start the scenario I just showed you. And just to let you guys know, there will be a little bit of an echo with me talking specifically. Hello.
What do you want? Can't you see I'm trying to rest here?
Hi there, my name's Will. I'm going to be your nurse.
Another one. Just great. You're just here to poison me with your meds, aren't you?
No, I actually wanted to first just introduce myself and see if you needed anything.
Save it, Will. I don't need anything from you or anyone else in this place, especially not your lies. Don't think I don't know what's going on here.
I can see that you're upset.
You think? You think you can just waltz in here and read my mind, huh? Well, let me tell you something, pal. You don't know the first thing about me. So don't try to play shrink with me, got it?
Okay. Well, is it okay if I get you on the vital sign monitor and just check your vitals, and then I can give you some space?
Vital signs? Are you kidding me? I'm fine. I don't need some machine telling me how I'm doing. And even if I wasn't, what would it matter to you? Just leave me alone.
I understand you feel that way, but we're in the hospital. I just wanted to make sure everything's looking good, and that way I can, that will allow me to give you some space if that's okay.
Spare me the sales pitch, Will. If you're really so concerned about my well-being, why are you trying to strap me to a bed with wires and machines? It's all just a ruse to control me, isn't it? To drug me up and shut me up. Well, it's not going to work.
Well, I don't have any drugs with me at the moment or anything, so I'm not sure. Did something happen before I came in the room? Can you hear me? Did something happen when you came in the room?
What the hell are you doing to my arm? Don't do that again.
I'm just checking your blood pressure.
Get your hands off me. That's not a blood pressure cuff, that's a torture device. And don't think for a second that I don't know why you're really taking my blood pressure. It's so you can adjust the dosage of the poison they're feeding me through the IV. I can't stand you. If you come near me, I'm going to knock your head off.
Okay. I can see that you're upset. I'm sorry I took your blood pressure without asking.
Don't think a simple apology is going to make everything okay, Will. It's not about the blood pressure. It's about the fact that you people are trying to control me, manipulate me, and poison me. And you're just a pawn in their game.
Sanjay, do you know where you are right now?
For crying out loud, do you think I'm an idiot? Of course I know where I am. I'm in this pitiful excuse for a hospital surrounded by incompetent fools like you who are only here to make my life more miserable. Now stop wasting my time with these inane questions and leave me alone.
Can you tell me your name and date of birth?
I won't. My name is Sanjay Reddy, and I was born on February 8, 1852. But don't think that's going to help you figure me out, because it won't. And even if I told you, it wouldn't matter, because you're just going to use it against me like everything else.
I don't think you were born in 1852. Do you know why you're at the hospital?
Shut up. You don't know anything about me. And as for why I'm here, it's because the demon sent me here to destroy this place. That's why. But you're just too blind to see it.
All right. So we didn't do the scenario in its entirety just because limited time today, but we will go ahead and show you our grading report here. All right, so right away, the user can go ahead and see their, I just want to make sure, okay. Yeah, they can see their grading report. So we had our overview here. We didn't obviously do everything, so we don't have a great score. But just depending on the scenario you create, the educator can evaluate whatever they want. We didn't necessarily de-escalate the patient, but we didn't necessarily escalate it to a very dangerous level, but they did threaten once. So that is where you get that grade there. Communication, this was one of the key objectives in here was to do a good subjective history interview. We obviously didn't spend the time to ask all those questions, which may have opened the door for more escalation. So that's where the scenario itself gets pretty challenging. And then safety, so we didn't do, just general safety checks here. And then our documentation. And then here we have the whole transcript. So think when you're with your students, this can be done in med-surg or any other course. It doesn't have to just be psych. They can look through and actually reflect on the entire conversation with the character. So that way, if they did, for example, I think when we took the blood pressure without asking first, that was one of the triggers. So as you saw, that did make the character pretty angry, the patient pretty angry. So here's where I can look back and say, oh, well, that was one of those things that I should have at least warned the patient first that I'm going to take the blood pressure. And when we first had the conversation, they of course weren't okay with me putting it on. So we went ahead and did it anyways, just to show you an example. But after I'm done looking this over, I can grab it from my grades and bring it to group debriefing with the rest of the students, or of course I shared it with you all too. You could do a similar thing with your students. So we'd move on and answer some debriefing questions. For this purpose, I'm just going to go through and just complete the assignment. We're going to see. And then that way we'll show you how you could take it. And the educator and the student can now look over it together and see, what they can do to improve the next time they do the scenario. So that's how quick things can happen. I don't need, a scheduling for the standardized patient or use mannequin-based training where you have to do group because you only have a certain amount of time with them in the sim lab. This can all be done on demand. So that's where, as innovators and educators, we could use technologies like this that will help give your nurses more time and more practice that's interactive, not just using it in theoretical learning or at clinical sites. Because, of course, at clinical sites, we don't want to just throw students into a de-escalation scenario. I don't see very many educators doing that. Because, it's too risky, obviously. So this is just a nice way to bring it to life for them and give them that repetitive practice that they need. So any questions that you guys want to ask? That pretty much concludes our webinar today. We got done just 6 minutes early to leave some questions or leave time for any questions that you guys have. And once again, any input or anything that you guys want to share with other educators that you guys do that's working well for your students. But the whole concept here is that way we can find ways as educators to improve the opportunity to practice things like this to help, reduce the frequency of workplace violence for nurses. So, anything? I think we might have had we have one comment on our. So it looks like we had some. Zachary was using virtual reality. Anybody else? I'm just out of curiosity. Anybody else using virtual reality already? Or yeah, how about we do that? We can open the mics up if anyone wants to talk. Let me see if I can do that real quick. We'll see how fast I can do it. Jane, I'll unmute you first. Let's see. I just allowed you to unmute your mic there, Jane.
Yeah, no, this was really exciting. And it's definitely something that's been part of my research portfolio as part of my PhD. I'm an emerge nurse. And so that's where I created the in-person scenario. The challenges with in-person scenario in healthcare education is the manpower and time is needed. So if I have 187 students, it's going to take 187 hours of sim. Right. And we just don't have the capacity for that. So that's why I created a pre-simulation preparation virtual screen-based sim and used that with students and did research comparing its perceived effectiveness and cost. And then now I have taken it and made it into a virtual reality with a PhD student. But again, I don't think we need to reinvent the wheel, and you've got this amazing program. I would like to see it as a group of us, I mean, there's 25 people here that are all interested in it to conduct some research on it. And yeah, I think it's amazing. Great job.
Thank you. Yeah. And yeah, Jane and I have talked before, and she's very experienced, and that's just people like her can make a huge impact on like transition to practice. And there's obviously thousands of things we're trying to get our nurses prepared for when they get to the bedside and whatever role they're in after graduation. But this is one of those things that can just not be ignored. Simply is and she explained it perfectly. Is just that there is just a manpower issue in a lot of things that we have as educators, and if we kind of look to technologies that help scale, just that right there alone is a big benefit, is helping it scale and extend our educators' arms to help reach more nursing students. So, but yeah, that's great. Thank you so much for coming in. And anybody else want to have the mic to put in their experiences? And if you are interested, we had somebody ask if you are interested in booking a meeting with us to learn more about the product that we showed a little bit today. You can book a meeting with that link in the chat there. But I am done. I appreciate you guys taking the time, and feel free to stay on if you do want to have an open mic and talk. But we are done. You guys are, of course, free to go. So thank you so much.